Years ago, the discovery of insulin became the first life-saving treatment for diabetes. And since then, there have been many new discoveries and treatment options available to those affected by this condition. Joining us today to talk about what's new in diabetes care is Dr. Eglis Bogdanovic, a board-certified endocrinologist with Charlotte Hungerford Hospital. Doctor, welcome.
Nice to be here.
Great to have you. So what are the first signs of being a diabetic?
Well, diabetes is all about high blood sugar. So when your blood sugar is high, your urine sugar is high. So it drags a lot of water with it. So people say that they're urinating more, perhaps getting up at night when they usually didn't. When that happens, you get dehydrated, so you end up drinking a lot of water. But if the sugar continues to stay high, you get blurred vision, unintentional weight loss. And, sometimes people just come in with an infection, like a foot infection, and they didn't know that they had diabetes, but it's been undiagnosed. And in fact, 1 in 5 people with diabetes in America, so that comes out to about 6 million people, actually have diabetes but don't know yet. So it's really important that anybody over the age of 45 be screened for diabetes.
All right, doctor, talk about the options when it comes to treatments. What's the latest, greatest?
Yeah, in the last 100 years, it was insulin for a lot of years, and then all of a sudden in the 70s, various classes of agents came out. There are now, my last count, 13 classes of medicine, some injectable, some pills, for type 2 diabetes. And the trend these days is to use something that not only does it lower your blood sugar, but it decreases your risk of dying of heart disease or having a heart attack or a stroke or progression of your kidney disease. So it's a hopeful time for type 2 diabetes. For type 1 diabetes, it's a little bit different because type 1 diabetes, you require insulin, but there are a lot of new advances in insulin therapy as well.
Doctor, how has medicine for diabetes evolved since the discovery all those years ago?
Well, that discovery was in January of 1922, so 100 years ago this year. And the guy that discovered it, Frederick Banting, probably didn't think that we wouldn't have a cure by now, but we don't. So we're still using insulin, but we're using insulin in insulin pumps, insulin pens, even inhaled insulin, and we've got all kinds of new devices that can actually improve the quality of life for people with diabetes as well.
Doctor, tell us about glucose monitoring. You touched on it a little bit.
Yeah, it's about 60 years ago, we were actually checking urine glucose. Remember I said that, when your blood sugar is high, your urine sugar is high. And then about 40 years ago, when I started doing this, we started to have glucose monitors where you did a finger stick. Now everybody's got a machine at home to check their finger stick glucose. But about 10 years ago, a new revolution happened, and that is continuous glucose monitoring. And with these monitors, you have this little filament the size of an eyelash under your skin that transmits your blood sugar every minute or so to either a receiver or your phone or a smartwatch. And that has actually improved glucose control, not just preventing low blood sugars, which is why we started using it initially.
Amazing. All right, doctor, 30 seconds left. Tell us about this online event you have coming up.
Well, every year we celebrate World Diabetes Day, which is actually Frederick Banting's birthday, November 14th. And the month of November is Diabetes Awareness Month. So we have a talk for patients where we go over, what's new in diabetes, a lot of things about these glucose sensors, about new drugs for type 2 diabetes. And that's going to be at Charlotte Hungerford Hospital. It's going to be next Tuesday evening at about 6:30. And I'm sure that you can get all that information by just looking up Hartford Healthcare, Charlotte Hungerford Hospital.
All right, Dr. Eglis Bogdanovic, endocrinologist at Charlotte Hungerford Hospital. Thank you for the information.
Thanks so much for having me.